Checkpoint blockade in particular, I mean, it has revolutionized treatment. For example, in melanoma, which in 2011, when the first immune treatments were approved by the FDA, the median survival was 7 months. And after diagnosis, only 3% or so of people were alive at 5 years. Now, almost 60% of patients are alive at 5 years. I mean, it's been a remarkable achievement. But most of these patients are being treated at major academic centers in the cities and not necessarily in rural communities or even in smaller towns. And one of the reasons is in this case, perhaps associated with, well, for sure associated with the fact that there are adverse events associated with the treatment. They're troublesome. They differ from patient to patient. And so it takes a while for a physician to get used to them. And it's very different from the toxicities that occurred with chemotherapies and things that were pretty stereotypical and same in every patient, and a doctor could learn very quickly. But these, some patients don't have any, some have pretty serious ones. They differ, and they have to be recognized quickly and dealt with. And it's just a lot of physicians, I think, just opted out. They're not willing to take on those additional burdens, and so they just don't adopt the therapies in their practice. And the only people who can benefit from these curative treatments are the ones who are either at the medical centers or are sent there by the doctors who are at least aware of it. And that's a very, very big problem now.